Now, what is the goal of the treatment of OSA? To resolve signs symptoms of OSA, to improve sleep quality. That is very important, and normalize our apnea hypopnea index. That is the aim of our treatment of sleep apnea. So, my topic is medical management, already discussed. So, the first thing is, and most important thing is your patient education and behavior modification. And that is the most important part or key part of the medical management of OSA. And that is recommended by American Academy of Sleep Medicine, American Thoracic Society, and American College of Physicians. What is that? Change your lifestyle. So that is the first issue of medical management is lifestyle changes. What is that? Number one. And the key one is your lose weight. And that is the key point. Professor Litu said yesterday that only 2 points is important. One is lose weight, and lose weight. And number 2 is maybe machine or maybe surgery. So basically management depends on only 3 key points. One is body reduction, weight reduction. Number 2, machine, CPAP. And number 3 is your surgery. So how to lose weight? The classical is you have to experience your weight. That means do more physical activities, take less intake, and fatty food you have to avoid. So no fast food. So we have to ensure more vegetable and vegetable. How does it work actually? The weight loss includes that from bariatric surgery improves overall health and metabolic parameters, decreases ASI, reduce BP, improve quality of life, and decrease daytime sleepiness. So, weight reduction can improve all the parameters of the sleep-related disorders. So that's why it's very important to reduce weight. When the patient coming to us, I said, if you reduce about 5 to 10 kilo weight, about 50% of your snoring will go off, and about 10% of your sleep will go off. So, reduction of weight is very, very important. And do regular exercise. Exercise is very important to reduce your body weight. Even one study done by American College of Physicians study and one meta-analysis, they showed that if you do regular exercise, despite of your reduction of weight, suppose you are doing exercise but your body weight is not reduced, still there is a greatest improvement of your apnea, hypopnea index. So that is the exercise may modestly improve OSA, even in the absence of significant weight loss. That's why exercise is very important. But what is our time actually? We are a very busy doctor, no time to have this exercise. Then number 2 is sleep position. As you know, this is a common that if you lie down, when supine position have more apnea or tongue fall back. So that we always ask the patient to sleep on lying, lateral position, and that is very important. So don't sleep on your back. Actually, this patient is very fatty and obese as well. So always ask the patient to sleep on side. Look, in this position he has got snoring. He was snoring actually, but when the position changes, look how nicely he is sleeping. There are some commercial devices available that has got a vibratory impulse with around the neck, so that if the patient has got change of position, suddenly that can give vibration, so that they can change his position. Other medical measures like alcohol, they previously said that you have to abstain alcohol about 2 hours before sleep, but now they say no. Don't use even alcohol. Even alcohol taking during daytime, it also causes some problem. So we avoid alcohol even during daytime. Why alcohol avoidance? It can depress central nervous system, exaggerate OSA, worsen sleepiness, and promote weight gain. So these are lots of hazards of alcohol. So that is why we have to avoid alcohol. Also another is smoking is discouraged. So avoid smoking. what about the nasal decongestant and allergy medication? Now, any patient come to us, I usually give this because if you don't want to do any operation or anything, at least they said, no doctor, I don't want to do anything, please give me some medicine. So believe me or not, if you give nasal decongestion like steroid nasal spray, montelukast, it works sometimes. At least you are giving something, it can also reduce the nasal congestion, it have a good nasal airway that can improve indirectly. So nasal medication is very important here. And what about that? Also you have to avoid any sleeping pill, diazepam group, benzodiazepine group, all this you have to avoid this one. Other drugs that can worsen OSA is barbiturate, anti-epileptic, sedative, antidepressant, antihistamine, especially histacine, promethazine, phenergan, all these drugs shouldn't be used. Now, so that is the most important is lifestyle changes. So once the lifestyle fails or sometimes it doesn't improve, then definitely there is one option of medical treatment is your most effective way is your CPAP machine. And that is the key point of management of medical treatment is continuous positive airway pressure. Because with this, they have time set of the pressure so that the internal pressure and the airway is keep open with a very good airway. It will not collapse. During the polysomnography, we have to also test this one if the patient can benefit with the CPAP machine. Efficacy of CPAP, it reduces the frequency of respiratory events during sleep, decreases daytime sleepiness, improves blood pressure, lowers the risk of crashes, improves erectile dysfunction. That is very important, and we are very much concerned about this erectile dysfunction regarding OSA. And we all people are very much concerned about this, and it improves that. There is some problem with CPAP because many of the patients they don't like CPAP, and after operation, after using that one in the morning time, they have very puffy face, facial edema, all these uncomfortable. Sometimes they experience headache, airway irritation, cough, chest pressure, and sinus infection. So to overcome that, there is some small micro device in alternative CPAP, and there is another is BiPAP. BiPAP is a bilevel positive airway pressure. The reason is it is very small size, like your tiffin box. Look at this, not like a very big machine. So BiPAP is also effective. This is BiPAP. If the patient has some problem with the CPAP or BiPAP, if they don't like that, then we have some other devices like oral devices. These are different designed oral devices. Already, Professor Prof demonstrated that. These are different types of oral appliances, oral mandibular devices. And last of all is your drug. Is there any drug actually to work on that? Well, there is some drugs. Modafinil is approved by the US Food and Drug Administration. But eventually, after many studies, they did with the meta-analysis and case studies, they said it's not, eventually it's not that much effective. So actually, what is in our hand then? This is the classical ACB guideline for the management of OSA in adults. What is that guideline? Recommendation 1. ACB recommends, ACB means American College of Physicians. All overweight and obese patients diagnosed with OSA should be encouraged to lose weight. That is number 1 recommendation. Number 2, ACB recommends CPAP treatment as initial therapy of mild, moderate. Now they say mild, moderate, and severe OSA. The CPAP is the number 1 choice. Recommendation 3. ACB recommends mandibular advancement device as an alternative to CPAP. Who has a problem with CPAP or who prefer mandibular advancement devices. So that's our medical treatment. As I am a surgeon actually, I am not sleep medicine specialist, but this is very important that before doing any surgery, at least we have to think, yes, there is some alternative treatment. Thank you very much. Sleep well, live well. Thank you very much indeed.